Good day to you. Welcome back to my channel Knowledge for Dummies. I'm Keith. Today I'm going to share with you a special video about COVID-19 symptoms and its prevention methods. Do you know that as of today, 23 October 2020, COVID-19 have actually caused 4.2 million people sick with this disease and 1.1 million people actually dying from this disease itself? It actually caused a catastrophic pandemic in the whole wide world, start from 2019, the end near November, until the current day, with no stopping on this pandemic. So let us look clear on what are the symptoms of COVID-19 patients that you need to be careful on, and what are the 5 prevention methods that I recommend for you to practice daily. Now I'm going to share with you about the symptoms of COVID-19 sickness itself. I will segregate the symptom into 3 stages: the early stage, the mild stage, and the later stage itself. Do you know that during the early stage of this COVID-19 symptom, it actually causes you to have loss of smell and loss of taste itself. So this means that actually you cannot smell easily, or you lost your taste buds itself. So it means that you eat something, you do not have any taste, or you smell something, it's just plain only. So another thing is you also have rashes in your fingers and your toes. It will cause some red rashes with blisters on it. So if you experience any kind of this symptom, beware and please take your temperature checking and also consult the doctor itself. So if you smell something and eat something, you do not have any taste lately, do consult the doctor. Next, we'll go to the mild symptom itself. For mild symptoms, people will experience COVID-19 sickness itself. They will have fever, they will have sore throat, they may have flu, they may have diarrhea, headache, body pain, or a mild difficulty in breathing or shortness to breathe. During this stage is actually a very serious stage already. If any one of you experience this symptom, please immediately go to the local approved doctors in your hospitals in the region itself for relevant and experienced checking to confirm whether you have this COVID-19 sickness. Now I'd like to share with you the serious symptom in the later stage of COVID-19 sickness itself. Do you know that majorly COVID-19 are spread from one person to another person through droplets of water that is transferred from human to human via sneezing, coughing, or even talking when they are near to each other. So these droplets of water normally enter the body through the eye, nose, or mouth. Once they enter the nose, it will go through your trachea, go to your bronchus, and go to your bronchi, and later enter the alveolus in your lung itself. Do you know in your lung actually there are millions of alveolus, which is a balloon-like structure that help to transfer between oxygen and carbon dioxide between your lung and your red blood cell in your body to enable you to breathe smoothly. So this COVID-19 virus actually attack your alveolus and cause your alveolus to be contained with fluids and water, which actually choke you alive. So your lung itself will contain a lot of water and you're unable to breathe properly. During this stage itself, normally you are being sent to the hospital with the ventilator to help you to breathe. This stage we call as ARDS, or we call as acute respiratory distress syndrome. This kind of syndrome causes normally people very difficult to breathe and fatality is quite high. If this syndrome itself do not come down and it get more serious, you will develop SIRS, or we call as systematic inflammatory response syndrome. This will cause the fluid in your body, the fluid that in your lung itself will transfer through your blood vessel to the major part of organs in your body and causes inflammatory to all the organs, which result in septic shock and also your organs failure. Normally in this stage, it is too difficult to be safe and fatality is up to 99%. After you know COVID-19 symptom it was, I would like to create awareness to all people out there on the ways to prevent you from catching this virus. Number 1 is none other than wearing masks consistently when you go out. Why do we wear masks? It's actually to prevent our droplets of saliva whenever we sneeze, cough or talk to transfer to another person, or also to prevent droplets of water from another person transfer back to us. So you must wear your mask tight above the nose consistently. Do not wear your mask underneath your nose or put it under the chin. This is a wrong habit done by many people. remember, wear your mask, cover your mouth and your nose up here. Okay? Next, I would like to share with you different quality of masks available in the market and its efficiency. Do you know there are a lot of different type of masks available in the market, and different type of masks have different efficiency in filtering out this virus? The first mask I'd like to share with you is this kind of mask, a one-layer mask, white in front and white inside. This kind of mask is not advisable to be used because it only contains one filter layer, which means that it cannot efficiently filter out all the coarse or ultra small particle, even the virus, from getting inside to you. So another mask I'd like to share with you is this surgical mask, which is a blue on outside and white on inside. This kind of mask is recommended to be used because this kind of mask is a 3-layer mask and it can actually filter out coarse and mild fine particles efficiently if you wear it correctly. So whenever you wear, remember, wear it above your nose, covering your nose and also covering your mouth at the same time. The last one I want to recommend to you is actually this N95 mask itself. This N95 mask is actually expensive mask, with one mask roughly costs around 5 ringgit, but this kind of mask is actually very efficient because it's thick and it has multiple layers of filters. Once you wear it, it will cover your whole mouth and nose without any space coming out from there. So this can actually effectively prevent the virus from going into you. But this kind of mask is actually expensive. Not everyone can afford it. So I recommend the type 2, the surgical mask, or this N95 mask for all those that can afford to buy this type of mask. Number 2, I would like to recommend you to bring a bottle of hand sanitizer to wash your hand frequently whenever you go out. Why do we need to wash our hand frequently with hand sanitizer? Do you know that hand sanitizer actually contains 60% of alcohol that can actually break the wall of the COVID-19 virus itself? It can break the membrane wall or the cell wall, outer surface of the virus, that act as a hand to attach to a human cell itself. Whenever washed with this alcohol, the alcohol will destroy the outer cell of this COVID-19 virus and prevent this virus from attaching to the human cell. With this, it can effectively prevent the virus from transmitting from your hand to you, because we do not know our hands are touching what kind of surface available outside and whether these surfaces are contaminated by virus or not. It is even safer to wash your hand with soap for 20 seconds, washing in front, back, inside, outside, every surface of your hand efficiently to curb this virus. Number 3, for people that actually live in red zone or places that have high risk of COVID-19 virus, it is advisable for you to wear a personal protective equipment (PPE) such as this, a face shield mask. This face shield mask can actually effectively prevent any droplets of water from the COVID-19 patient from reaching your face once you wear this PPE itself. It is also advisable for you to wear hand gloves whenever you are near or whenever you deal with COVID-19 patients. Number 4, I would like to recommend to you to use antiseptic or soap water to wash your clothes that you wear once you return to your home, and also to wash any items that you bring into your house, such as your groceries. Because do you know actually COVID-19 can survive on different kind of surface for a long period of time? Example, COVID-19 actually survive on paper or tissue paper for 3 hours, copper coin for 4 hours, cardboard paper for 24 hours, wood for 2 days, cloth for 2 days, stainless steel or plastics for 2 to 3 days, glasses for 4 days, our paper money for 4 days, and outside layer of your mask for a week. So we must be very careful when handling with multiple surface. After you know the 5 prevention steps to prevent this virus, I hope everyone out there can actually implement and be disciplined to carry out these prevention methods efficiently. We should be thankful to our government and health ministries for implementing policies, SOP, and also providing medical care to all the COVID-19 patients out there. I believe it is not just the responsibility from the government itself. It should be the responsibility from all parties, from all walks of life, from all individuals in the whole nation itself. We should actually practice social distancing, wear masks whenever we go out, and do not go out simply for no reason. We go out only for official and important reason only. Do not take risks unnecessary. with that, I believe we only can success together to prevent this virus. Remember, together only we win this war.